Andrea Simon here. Thank you so much for joining our Healthcare Innovations Trends from the Trenches webinar. I see people are signing on, so I will wait a moment and we will get going. We have people from across the country and from different industries, both vendors to healthcare institutions and the healthcare institutions themselves. So thank you for joining us today. And let me introduce my co-presenter, Linda MacCracken. Linda is Vice President of Advisory Services at Truven Health Analytics and an adjunct professor at Harvard's Public Health Institution. I'm a corporate anthropologist and president of Simon Associates Management Consultants. We are an organization that works with companies that need or want to change. And we do a great deal of work in healthcare and healthcare innovation. We've put together this webinar series because what we were seeing in the field was a lot of confusion about how do we respond to changing times and how do we respond to a customer, patient, family, community that's also changing. So the dynamics, Linda will talk later about the perfect storm, is really quite fascinating from a cultural perspective, but also from helping organizations better understand what they have to do. Our job is to help people see things in new ways. What we're all about is, and this was a quote that was given to me by a client in Ohio, we don't see things as they are, we see things as we are, from the French diarist Anis Nin, which I thought was a great way of capturing the challenges that we're facing. And that the real voyage of discovery consists not in seeking new landscapes, but in having new eyes. So our job is to help you see, feel, and think in new ways before you do things. You must remember that the brain makes decisions based on the oldest reptilian part, what you see, and how you feel. And the neurosciences are helping us understand that how you feel, the emotions, are really where you make your decisions, and then you justify it with a lot of logic. So while there's a lot of data, in anthropology we often say data do not exist. What do they really mean? What do the information really turn into insights? Today, Linda, our guest, is going to share new research insights about consumer behavior and the key innovations that are needed in healthcare marketing. In particular, it's very interesting. Some of Truven's research I found very compelling, even for many of my clients who are wondering, what do you do with social media? One in particular was a health system that leveraged social media and outreach campaigns, drove people to call centers and online contact centers, and generated in over $1 million in incremental revenue in 1 year. Another one focused on web-savvy patients and was able to demonstrate more than $4 million in revenue over 2 years. So part of today is to understand how the data can help us do better business and also help our patients in innovative ways. Second is how big data analytics can shine light on innovation. So how are they connected? Do the patterns of the past help us in the future? And help us return to the question about why consumer data matters. What consumers are feeling today? Confused, cynical, and angry. And I've done enough ethnographic work, innovation games with them to say, boy, they are untrusting. So what are we going to do about it? The challenge is, how do we imagine and engage consumers that still or finally are going to make our service the place to get care and the place to innovate? If they're changing and we're changing, you can just anticipate the unexpected and unintended consequences. Can you inspire your associates and physicians to look at analytics to benchmark and drive new types of care? This was one of the questions all of you who are watching sent in to us, and we'll talk about it again at the end. And can you bring in evidence? We're all into evidence-based medicine, evidence to launch innovative ways that add real value, not just engage around storylines. So as a setup for Linda's, I'd like to talk about what we see happening in the field. These are things that we are watching as we do our deep hanging out and our observational research. That changing times make data really, really, really important. Is what we're seeing an outlier or the patterns? Can we see leading indicators? Things that are coming, not the lagging ones. Can the data of the past help us with the future? What are the emerging trends? How do the dots connect? And can we see real-life behavior in the data themselves? This is always interesting. How does the data turn into real behavior? And can we trust it and let it help us change? What are we looking for? It doesn't matter if we're a provider of services to a healthcare institution, the institution helping doctors or payers and so forth. And today, we got to look for patterns that are coming out, opportunities to leapfrog over the rest. Benchmarking has always been an industry standard, but if nobody knows what they're doing, how can we benchmark? Are we looking for trends quickly and respond? Can we leapfrog over and create, not just compete? Non-users with unmet needs that might open a new way to deliver care their way, not the old way. And that's extremely important as we're looking at the younger generations who are defining the next generation of healthcare. If these times are changing, it doesn't matter what role you're playing in the industry, how do we create this new value? Explore opportunities to open new market space. Who are non-users with unmet needs that are waiting for us? Think about those who are finally becoming insured. Their whole behavior patterns may change or may not. How will they know how to use their insurance? Or how about men with unmet needs that only 60% of men have doctors? Include consumers, patients in the evolutionary process. Don't survey them because they can't tell you, but if you include them, you might come up with some great ideas. This is particularly important. There's a hospital system in Florida that's reinventing itself to go after population health and to keep people well. And as I talked to their chief marketing officer, the challenges are so numerous. Can the data help us show better ways to engage, communicate, and tell our stories if we're going to shift lifestyles and consumer habits in new directions? Remember, if you have to have new eyes, so do those consumers. And if you can help them understand the changes and engage them in the process, boy, can you make a big difference. This is leading to a tremendous communication channel. And Linda will speak about this at some length. Listen carefully. How do you engage consumers and patients? Match the message and the storytelling to their demographics and psychographics. That means you may have multiple messages for different market segments and psychographics. How do you measure the impact? So let me turn this over to Linda. As she begins, please keep in mind that all of this is to help you do a better job. And some of the insights that are going to come are going to be catalysts. We'll have enough time at the end to ask the questions, so please, write them down and keep us in mind. Linda, I'm going to turn this over to you in exactly 1 second. I'm giving you the keyboard, and then Linda, you should be able to take charge from here.
Wonderful. Thank you very much, and good morning. It's morning here in Phoenix, Arizona. I'm delighted to be with you all, and Andy, special thanks for the chance to work together on this webinar. I've really appreciated Andy helping flesh out what are the key questions that are those that need to be answered, with the first one really being what can we know about consumers to shape our data-driven innovation. The compilation of all this information comes from asking the right questions. The second question is what data shows us, what's likely to change in the keep me well, fix me to keep me well world, the fee-for-service world or fee-for-value, and what I find in working through various markets is most organizations are trying to make sure that we live in both worlds. And then again, there is innovation that's available from data identified opportunities. I'll show you some examples, and then we'll talk about some practical steps that can be taken to drive value from the trenches that have helped some other organizations that I've worked with. It really seems like we're facing a perfect storm, and for those of you familiar with the movie featuring Matt Damon, George Clooney, or the book featuring a storm that occurred in the Gloucester, Massachusetts market in the early 1990s. There were 3 storms that went over one area, and a sword boat fishing captain and his team went down. So regrettably, a team went out to go fishing, and faced with 3 storms, they did not survive. But because we do have this convergence of 3 big effects, and you may have others, so you could say it's not just 3, Linda, it's 5, it's 10. But at least these 3 are significant. But again, having this conversation is going to make the difference between their unfortunate demise and your not only survival, but flourishing. The first key point is that consumer-driven decision-making is really crucial. Our consumers actually have many more choices. When the Cleveland Clinic is moving to same-day appointments, or other notable health systems are moving to when-you-want-it appointments, then we're facing some very different competition when people say, should I stay in my local market or should I go to Cleveland and get a same-day appointment? The second major factor is unknown provider competition is already in play. And I'm sure all of you look around in some of the urban markets and see the retail health providers in Walgreens, Walmart. But what's also, an interesting innovation to watch and then be prepared for is if telehealth will really make a big difference or not. And telehealth is, Cisco offers a booth which is actually quite popular, especially in rural areas that are hard to reach, that is very effective, where a physician is on the other side sitting almost, again, in a telehealth setting and location. And the patient satisfaction ratings of this telehealth booth via Cisco are extremely high and higher than many private practice offices. American Well, feel free to go ahead and Google them. They're a web-based, it's almost like Skype with a doctor. And so that's an interesting innovation. We'll see if that takes off. But when their client list shows Ascension on it, I would say that it's maybe more than a passing fancy. And then to the extent that our phones are now able to do self-diagnosis, take pictures, diagnose urinary tract infections, diagnose high blood pressure, and of course serve as our coaches, we now have competition from unknown provider substitutes. And just these factors are ones to bring up to say, so what will we be left with as healthcare providers? And the third perfect storm is the fact that healthcare delivery now is a team sport. And so we really need to have team-engaged priorities, business questions, and agreements. And I imagine all of you, when you go to spending, need so much more buy-in than for those of us that were in healthcare maybe 5 years ago or 10 years ago, where there was more solo authority over a budget. But change commitment requires, and purchasing and making moves requires more cross-team functionality. So this is sort of new pressures. So in the nutshell, we need teams with clinicians, administrators, pre- and post-care service providers. And so in bringing that alignment in, Storm Survival calls for an aligned team. Feel free to use this graphic as you start calling out to others how they need to join you on the marketing side of the boat, so we're all moving together. So to go towards that end, Andy and I wanted to bring you a change model or a framework that could potentially be available for you to consider when you start working with your teams. And my goal in some of our time together is to give you some facts that let you go to your teams and talk about consumer-driven healthcare is really crucial. And again, for those of you who are marketers, you say, I'm the voice of the customer. For those of you in any other function, you can say, I'm the voice of the customer. So the opportunity is to take the data or any facts, kind of like global warming and these penguins' story, to create the urgency, pull together a guiding team, and say, what do we see as our ultimate survival into this future? And then communicate for understanding and buy-in. My cousin is actually one of Al Gore's global warming scientists, and sometimes his opening line into a community is, the polar bears are eating each other. He says it's rather an effective immediate hook versus all the science and the charts and the graphs, which, as a brainiac he has. And so the point is, how do we make sure that we hook people where they live? And I'm also hopeful some of the consumer data will give you some factoids that you can use when you're working on engaging the physicians and the clinicians. So once we've got the vision and we know what the changes where we're going, it starts to empower others to act and work with you to have a consumer-engaged strategy. The framework by, and again, so here you can see I've actually put this on a slide, and you can see if you just go down to the bottom part, empowering others to act, producing short-term wins, don't let up to create a new culture. And the reason I bring this up is just to give you a framework, and you can see there's key factors. But this could potentially be a tool for you when you go to a problem that you want to identify with a team, and then you say, let's go through this process, and you use the data, and again, we're trying to arm you to create the urgency and say, our iceberg is melting, but we have some big change factors that we need to adjust to. And again, let this be potentially a toolkit for you when you're trying to say, how do I get others on board with me? So we leave this as a change factor. So the first question is, what can we know about consumers to shape data-driven innovation? And my hope here is to give you some tools so that you can, when you're taking the consumer story forward in your organization or when you're approaching your market, you can actually start having a simple framework to look at unique consumers. So what I'm going to introduce to you is consumers by segment. And for those of you who are saying, I've got a segmentation system, we actually at Truven work with a 56 segment system, a 66 segment system, but somehow our CEO doesn't always sort of tune into 56 or 66. So I want to share some insights with you about consumer drivers for just 4 segments, which is with a lot of healthcare organizations we've worked with, much easier to get them to understand how boomers are different than Gen Xers. And I'll tell you some funny stories how that worked. And again, what's really helpful in organizations that have been effective at saying we're going to approach them by segment is to have the consumer segment focus on the back of your hand or the back of your napkin. So with that, let me just sort of come up with a surprise viewpoint, which is consumers. It's surprising to me. Again, we have at Truven, we do a 100,000 person survey every year. And so we, again, we're an information company and we like to look at our information. But it was surprising to us to see the consumer views are just making it harder to in buying into reform. Because take a look at the fact that costs under reform are going to increase. That's the majority of what they think. That they'll stay the same is a mere 8%, but quality under reform, you can see the positions all over the map. For reform's goals to decrease cost and increase quality, having consumer alignment is not simple and it's not necessarily present. So your job is tough. So let me share with you an opportunity to consider how you might take the discussion forward to say, who do we want to focus on in our consumers for our strategic plan or our marketing plan, and share with you some lessons learned from a very successful healthcare organization. What they said is, on the right you'll see pictures of seniors, and they said, look, we have the seniors. We know we've got the Medicare, but our goal, our barrier in terms of serving the seniors is we really need to engage the non-Medicare. So then they said, great, let's come up with a new vision of focusing services on younger segments, but even better, let's just say, well, let's know who specifically should we work with in terms of our specific services and based on margin. So again, heroically, this chief marketing officer said, all right, I'm going to come up with my outreach programs and my service lines and my programs and understand the ROI of every one of my activities for each service line and each segment. And having those results at budget time came up with this wonderful outcome where the health system said we've got to do budget cuts. So COO and CEO call in every department head and say, I'm looking for cuts. And so my chief marketing officer, hero in this case, and true story, went in and they said, we'd like to make some cuts. He said, well, where would you like me to cut? And they said, could you cut your fitness program? And he said, well, I could, but that does bring in $7 million into orthopedics. So if I cut the outreach or the engagement, then we risk that. Oh, that's really a problem. How about the screening program? Well, I could, but that actually risks, another $2 million in margin from the healthy that are coming in. And so this went on, and at the end of the budget cuts session with marketing, this chief marketing officer was told, legal's next, I'll get my cuts from them, and you just tell us if you need more money. So the opportunity to say, I know who I'm targeting can have some great results. So let me just introduce a very simple system, though, of 4 segments. And this has been something that an CEO said was really helpful for her in buying into focused marketing, increasing marketing resources, by understanding the differences among the different generations, even on the team, and then understanding the needs. But here we have a cohort based on their birth year and understanding their needs based on what kinds of orientation they have to healthcare. And our research shows that the greatest and silent generation, again, remember, think of them, they grew up in World War II, they grew up in the Great Depression, they're grateful for Medicare. And they're grateful for physicians, and they're really good at respecting authority. And I, like probably many of you, have parents in this generation, and when I want to convince them, I say to them, the doctor said so. Because they are more likely to respect authority and say, I will do as you say, doctor. Then consider the baby boomers, to whom I've shown you a picture of Bruce Springsteen. Baby, I was born to question you. This cohort, now moving into being senior citizens, has changed every aspect of healthcare delivery as they've moved through. And for those of you maybe not in the baby boom mode, healthcare, maternity care used to be 10 days in the hospital, no questions asked, no individual care plan, and no multiple sites of care. We went one place to have a baby, that's it. But in come the baby boomers. There's books, there's individual care plans, there's multiple sites of care in which to have a baby. This is the generation that says, baby, I was born to question you. And in my other life, I teach physician executives. And one of the things they tell me is they are exhausted by the baby boomers walking in with 2 inches of a printout of materials and saying, doctor, let's discuss this. So we have a conundrum. So these are very different generations that will show you compared to the Gen Xers. Younger, more loyal to their schedule than they are to the physician versus the baby boomers and the greatest who are more loyal to physicians. I'm glad to see you if I can see you at Tuesday at 5 o'clock. The Chief Medical Officer at Advocate Healthcare is a baby boomer, and this generations came home to him when he said, my son won't see the family doctor that I raised him to see because he said, I'll see anybody who will see me at Tuesday at 5 o'clock. It's a different generation, known in the educational circles as more cynical, the first latchkey generation, and they question things. And so they just have fewer loyalty strings than the boomers are the greatest. And then we've got the millennials, who are the connect me audience. And again, it's text me, it's connect me, and as you can see, more, again, more humorous. We're talking emoticons. It's just a different population. One of the ways to go ahead and say which generation are you part of is to say which generation are you part of, which do you identify with. Let me just show you the math in terms of some of the utilization. We can see the height of the bar in this slide is the number of people alive in our country today. So as you can see, we got a lot of baby boomers and we've got a lot of millennials. And then when we start looking at who do we see in our hospitals or our healthcare organizations, it's a lot of the green, greatest and silent population. And if you take a look at the discharges per thousand or the visits per thousand, you can see that the greatest and silent generation have almost twice as many visits per thousand population as the baby boomers, and certainly way more than the millennial and Gen Xers. And so and almost 3 times as many inpatient discharges for that older age cohort, which is why when we talk to the staff in our organizations or in our hospitals, they're more used to seeing a higher preponderance of the greatest and silent generation because of their use rates. Okay, this many of you might say you know, but it was really interesting. I was working with a group of CEOs a few years ago in 2009 during the recession, and they said, I've cut all my print, all my advertising, and I'm only going with social media. And I said, great, you're now talking to the millennials and the Gen Xers who have the lowest use rate, and probably you want to influence your baby boomers and your greatest to come in. So you might want to consider when you start making budget cuts, who are you impacting? I leave you with that story because other chief marketing officers have gone back and said, I want to make sure that my media fits my use profile and my target population. So again, in terms of marketing outreach with the stories Andy was telling, we find that marketing outreach has a faster response rate on outpatient than inpatient. But I wanted to share with you some of our hot new research out of 2013, which is the primary care connection, and it was a surprise to me. First of all, I was surprised to see that 90% have had primary care providers for over 12 months, which is very good. It looks like there's still some engagement. I was impressed to see that only 60% or approximately 66% of the millennials have a primary care provider, although I'm sure they have a place to go, and only 80% of the Gen Xers have. So it's just interesting as to different patterns by population. So hopefully this data can arm you for saying my campaign is geared towards which population. So let me just comment on the fact that the different generations is actually a useful key. What some of the leadership teams have done to support marketing even further is to identify how many of us are baby boomers? Well, how much do we want the Gen Xers? And so in starting to talk about generations on a management team, that's been something that's extremely useful to use with a leadership team. Who of us are connected on Facebook is a question that one CEO used. Who among us are connected on LinkedIn? And when we started to understand that among the leadership team, and then contrast that to the use statistics in a local market of what prospects are on, then that's been a very useful way for a management team to say, it might not be me, but you're targeting a lot of people who I want to have in here. Primary care physician factors are ones that are very different. We see that the younger generation is actually a higher level of switchers and will be very different in terms of some of their healthcare delivery. And the older generations have a longer time in working and staying with their physicians. Some of the other key notable factors is in terms of the internet connection, physician websites are more used than their health applications, and even seniors know more about their physician websites than use the internet. So while they don't habitually use the internet, they do like to focus on their physicians. And the internet shows more health information, search and requests for diseases and conditions, medications and treatments and procedures in that order than basically looking for services. So having an information source or being able to get education is actually incredibly helpful for this information. Again, part of what we're also going to be looking for and is considering what different kinds of channels are important for each of our generations for healthcare reminders. The silent generation in our research really loves the regular mail, so direct mail is very powerful for them. It's actually the most prominent for baby boomers, and it's still #1 as a preference for health alerts to the Gen Xers. Now, the second leading factor is by telephone. Now, that doesn't mean that it's a phone call. It could be a phone or a text, but that's most important to the millennials, followed by the boomers, next to the Gen Xers, and even to the silent generation. But although we surveyed for the phone, that doesn't necessarily mean that we're talking phone or messaging, and both are probably important to be reminded. I think what's probably most useful to you is the fact that consumers are interested in health reminders and alerts. And as marketers, I'm sure you're thinking that's a trigger campaign for me. You know, I want to automate my marketing so that I can be reminding people that, oh, they're 40, mammogram time. Oh, they're 50, it's time to bring them a targeted message around colonoscopy. But I thought it would be helpful for you to have the 2013 pulse on, do they want health alerts? Looks like they do, even the youngins. So I thought that was kind of interesting. Direct mail is still important to, again, silence babies and Gen Xers, which is good because they're the higher users. And then the telephone, whether it's voice or mail. So use this to help inform some of your tactics. So I also thought that you might be interested in the virtual front door impact. So what happens when someone comes through your call center or your referral center, your contact center? It's some work that we went ahead and did to say, so what can you expect from someone who comes through your call or contact center? So I wanted to just share with you what's a number for if you actually do a campaign and have people come in through your call or contact center. It's an average of 14 encounters for anybody who's a senior, 14 also for the baby boomers, and there's my favorite Bruce Springsteen, my favorite boomer. And then for the Gen Xers, who are the educate me, I'm skeptical, it's a smaller amount of 9 encounters, but remember they're healthier, and 6 encounters for the millennials who are just interested in getting connected. In a nutshell, using the generations in the workforce framework helps shape the generations in the patient base focus on your team. Generations is also a very effective framework for one that the human resources folks are talking about. Again, if you're a manager and you call in somebody on your team for a one-to-one meeting without explanation, the millennial is more likely to come in and wonder if they're getting promoted or a bonus. And the boomer will come in worried they're going to be fired. It's just that we're all wired differently based on our proclivities. The opportunity is to say within each service, which generation actually are you targeted on or serving, and which ones do you want to get? So again, I've added some characteristics of marriage, age, gender, income, and children as a way for you to focus your marketing diagnostics when you get a request for marketing, because again, you don't necessarily want to have to deal with I think I need a brochure. Let's get a little more targeted. So again, the target messaging connections, I just wanted to share with you that, again, I've tried to arm you a little bit with one-to-one messaging on email, direct mail, newsletter enrollment. We've seen some great downstream ROI, such as Andy quoted at the beginning with some of our clients. that we can help with. An affinity group, we've had an affinity group of women, commercially insured women, that have actually brought in a demonstrable $4 million in 2 years. And even an enrollment in electronic health record, we've been able to help some organizations push through patient education into the electronic health record and understand who they are, so that providers or marketing departments can get a list of who actually saw that and what was their subsequent health care use. So again, some interesting ways of engaging your patients. I hope I've whet your appetite and interest as your own innovation. So the data that shows us what's likely to change, let me share with you some fun, fast facts so that it can illustrate your own efforts as you're considering them. How do people select services, and what choices do they have? What service scope and site of care delivery? We talked a little bit, are they getting outpatient care services in the hospital versus private sites? About 2 years ago, we saw that hospitals with increases in their radiology business, which is very profitable, were thrilled with the volume increases. The downside was the volume was increasing at a faster rate in private radiology offices. So effectively, the hospital's volume was up, but the market share was down. So key business questions is a great way to engage some of your teams to make sure that they're on board with your initiatives. And so again, I just wanted to underscore the fact of pre and post reform. We're seeing some, as you can see in 2010, we've got people who are, individuals in exchanges, in Medicaid. And so as you can see, the magic time of 2013, 2014, as healthcare reform unfolds, we're seeing some significant changes where the uninsured, the dark blue line at the bottom, declines. Very few people will be uninsured compared to what we were looking at in the world before 2013, while Medicaid will increase, as you can see, the dark line, and exchange enrollment will change. So if demand is a function of coverage, we're going to see a lot more demand in needing coverage. So again, I wanted to just share with you for the numbers of when people move into being from uninsured into being insured, we see some very different business. In my own hometown of Chicago, in the last few weeks, we've seen huge amounts of advertising for emergency departments because the use of insured Medicaid and enrollees of the emergency department is much higher than in any other insurance group, and is also another front door. But as you can see here, the impact is different. So what you're looking at is basically counties to show that Medicaid opt-in enrollment in 2016 is going to be very different. And so it depends on the local market, but the Medicaid growth from 2012 to 2016 is going to be different. And we understand that states are different. We'll be updating, the world that I live in with our team of scientists is we'll be updating this consistently, but if you've seen one market, you've seen one market. I mean, we're not talking about all living in Texas. And so I wanted to share with you some of the research that we've found about prioritizing the needs of the newly insured. And the reason for that is if all of those newly insured are going to go into Medicaid and it's going to increase, will our emergency departments be big enough? Probably not. And is that an opportunity for us to market more services that would replace the emergency department? Or could the emergency department be only the first stop for an urgent care visit? Because we'll be able to do marketing influence about saying, for your next visit, go to this community health center, or for your next visit, if you've got questions, visit our website. So there's a tremendous amount of marketing innovation opportunity, especially if you know what to expect. So I'm sharing with you the newly insured are not going to necessarily be women. It's more likely to be men, and it's more likely to be those that haven't gotten picked up in the children's insurance program, or women who've been through having a maternity service. And they do have different health habits. They do think they are healthier, which is why they've gone so long in terms of health insurance. So their use rates might not be as high as typical. But again, to prevent the overrun or overuse of our emergency department, we wanted to arm you with this. So some good news, some challenging news, and some things to watch with a lot of opportunity for innovation. So when our teams say, and I imagine we need more patients. One of my favorite one was, the urology big practice that said, I need some more patients, I need an ad campaign, and come to find that in fact this was only, they needed 2 more patients between the hours of 1 and 2:30 in the afternoon. That's not an ad campaign, that's a press story. So the key is to get the right patient, the right volume, and making sure that there's some capacity for appointments. And so I share this example for you to help frame some of the discussion so you don't feel the frustration I know many of you feel about the fact that we did a campaign but you had no capacity. The no room at the inn story is interesting at Christmas, but it's not great when you're a marketer trying to use your expenses and your resources appropriately. And so again, here's some of the story that I've shared with one of my health systems. They actually said, listen, we've got capacity in our primary care network for appointments, and we can actually take them in the next 3 working days. So one of the things we said is, okay, let's make sure we've got an appointment request button on the website. And so with our client, we were able to help them bring in an incremental $1.2 million for the of revenue and new patients into the targeted physician practice. Again, it was heroic results, a fantastic health system, but may we all do that. And then again, subsequently, it's focusing on the specific consumers to find, reach, and engage. And so the key point is we need to be different. And so one of the component suggestions I'd bring up to you to consider is we've got a program for service line innovation. And in order to do that, have the leaders present to each other. And if there's a number of organizations that you're working with service lines, have the service line leaders in your marketing teams present to each other about what kind of innovation that you're doing. And then secondly, provide a forum to showcase your cost-effective innovation to finance and to around what you're doing. Anybody on a population health team is really interested in how marketing can help clinical redirection or patient engagement. And to the extent that you can come up with, here's what it was before and here's what it was afterwards, really helps start to engage teams and identify, gee, we have many things going on, which the marketing department always knows, but we want to put forward to you in terms of your portfolio of successes. And I'd suggest engaging a senior leadership champion, whether it's the COO, the CEO, to say, I'm really proud of you. And again, as we look back at John Cotter's framework, say, that's terrific. Here's the key data questions. And again, what's next for you? So coordination of care alone presents a big opportunity in fee-for-service world. We have one health system that said, we find that everybody, of our heads in beds, 20% have diabetes, and they stay an extra day more than anybody else. If we could have better care coordination and more diabetes management intervention and discharge them a day sooner, we could have a savings. But overall, my company has actually estimated that care coordination represents a $50 billion opportunity across the country. And so I'd offer that your marketing engagement, patient engagement has a sizable chunk of that. I wanted to just share with you an approach to looking at chronic disease risk. And so pretty much it's here is where are the most chronically ill patients in Florida. And then say we're just taking the zip codes with the highest area and then converting it into a segment. So now, as you can see, we have those most likely to have a higher incidence of chronic disease that really comes into, and again, this is one of those bill slides. You'll see it in the final slides. And really what that comes up to is we've got 2 different segments that represents our greatest chronic health risk. It's the seniors making under $25,000 and it's the young people making $25,000. And armed with this kind of information, a number of our teams have said, you know what, we can take this information and the physicians look at this data and this slide and say, I can now build an intervention focused on what we need to do for the seniors and the young adults. So again, another example of using data. Consumer choices invite a lot of innovations. And so you can see some of these choices which we started commenting on earlier. Do I go to a doctor, retail, or do I stay home and Skype? And how much does it cost? Am I sick? If there's a high copayment of going to the emergency department of $300, people may say, am I really sick or do I not need to seek care? And what health reminders? So these are some of the choices today and tomorrow around which you may want to consider what kind of innovations do you want to build. This is an example of using some of the data that I wanted to share with you of an example. What we've profiled here is within a particular market of what's breast diagnostic procedures versus breast treatment procedures. So here you can see I've actually profiled Chicago, and happily, the University of Chicago Medical Center has a significant market share presence of partial mastectomies. Good, they've got the surgical volume. But I profiled Northwestern here because of their high preponderance of getting front-end imaging business and a different proportion of mastectomy and breast aspiration and biopsy. So you can see that when we compare market shares of diagnostic and treatment services, we just have a questionable means of, do we have patients sufficiently engaged in the front end or the continuity within our health systems? Another example of using the data to ask the right questions with our teams. Another opportunity of innovation based on the data that you may want to bring to your teams is the redirection or rebalancing of the emergency department. And I've just profiled in Broward County, Florida, what do the residents of Broward County do with their use in the emergency department of any hospital anywhere? No knock on any of the local hospitals. And I think the question here is, if it's basically 65% of the emergency departments are urgent, is there room for potentially redirecting patients to another care site that's cheaper? Because the emergency department is the most expensive outpatient use in our entire outpatient service system. So it's great if there's margin, but if we want to create more capacity, do we want to have the frequent flyers go somewhere else? So we worked with a healthcare organization that actually said we want to have the super users who have Medicaid and self-pay go somewhere else so we can create capacity for the rest. So we basically did direct messaging, one-to-one messaging for those super users in that payer group for 5+ visits a year and reduced the Medicaid and self-pay by 1.5 million within a year, which is great. There's several opportunities for rebalancing the emergency department. If any of you are interested in having your local report card and a conversation about what kind of opportunities that represents, please feel free to be in touch with Andy and me, and Truven will be glad to furnish you a report card of your own local market of one to four counties and have a discussion about what we see as the opportunity and influencing factors. So what innovation is possible from data-identified opportunities? You just saw that we talked about segment to identify actionable customer groups, finding small victories, and building a culture favoring many marketing innovations, starting with some of the analytics to say, is this the world that we want to have? In some, I would say that there's 4 unique customer segments, and it's easy because it's easy to hold up 4 fingers and say, you know what you're talking about is boomer behavior. They call, they argue, they want to debate, versus the Gen Xers, they don't show up. So I would just say, consider the 4 generations, digital natives versus digital immigrants. Sustainability, interestingly, the millennials and the greatest are ones who love that you're green, love that you recycle, versus the cost-sensitive pragmatics, which is, did we just raise the price for the consumer? There go the Gen Xers and the boomers. Personal friend, professional sales, boomers and graders, versus web attentive and engaged younger generations of the Gen Xers and the boomers. So things to know, I'm sure all of you were dealing with the new insurance exchanges and Medicaid and the shifts that's making in your marketplace. And again, even in the long run, even though the buttons on the Obama website, I mean, did a website ever get more attention? Feel good about the fact when your websites go down. But by 2017, 34 million more Americans will have insurance. And it varies. Think local. Remember that if we've seen one market, we've seen one market. Rethink the sites of care, because the traditional emergency department shouldn't be the first primary care stop for your enrollees. And think about all points of patient contact. I think there's a tremendous opportunity for marketing, because it's not only the voice of the consumer, but it's the communication and connectedness of the marketing department that will really drive innovation. And prepare to take on risk. Obviously, we're all living with a certain amount of risk. It'll be interesting to have a tipping point. Understand the inside of the newly insured and the health of the population, whether it's the profile of what's the prevalence of diabetes or chronic risk, and making sure there's sufficient capacity. Because again, if demand is a function of coverage, let's make sure the emergency room is not overrun in a way that we don't want it to be. And engage the newly insured personally. It's a concierge capability that will have some cost-effective payoffs and useful, profitable utilization down the road. It's a perfect storm. Go ahead and think consumer, position to deal with those insidious competitors that are out there, and prioritize and rebuild service lines. And with that, I think that we turn this back to Andy to talk about the services not being as usual.
Linda, that was absolutely fascinating. I'm sitting here making mental notes about how we can help our clients begin to see, feel, and think in new ways. So I added a couple of slides just to give it some human touch, because in some ways we always balance the soft with the hard. So perhaps you two can give this a little bit of themes that are worth sharing. The first one is that the newly involved men in healthcare decisions, while you spoke about Medicaid and the newly insured being male, we know that only 60% of men have doctors. There's a whole movement coming to begin to understand how they don't take care of themselves. They die 10 years earlier. But they're also becoming much more involved in healthcare decisions. And we saw this in some work we were doing. They had to pay more of out of pocket, so they're really into it. The internet is changing the decision process. A client of mine's mother went online to take a look at what was going on, and she said to her daughter, I have shingles. I'm going to the doctor to talk to him about it. She is of the silent generation, but she was 80 years old and really into the internet. Everyone's searching for simple and easy, and particularly the millennials, but even the Gen Xers, but nothing was simple or easy anymore in innovation games that we were doing. It was frustrating. Across the demographic segments, the loss of trust was coming out in their stories. And then on the other side was the paradox of choice. The abundant options were leading to too many options, so nobody was making a decision at all. There's great psychological research about how Americans have so many choices that they stop making them for fear that if they make one now, it would be a better one tomorrow. They've lost the ability to see the difference from a branding perspective. Common statement, aren't all doctors and hospitals the same? Shouldn't they be? And the charge of the retailers, they are coming on strong, whether it's a CVS mini clinic or a Walgreens that's going into the hospital to giving people their prescription at the bedside. There's something coming that's going to transform access to care. How can you apply all of this? How can you adapt to the changing times? Consumers are driving and can change. The data is shedding compelling information and insights that you have to begin to understand. You have to put the flesh on the numbers and watch it. So if we're going to engage and communicate to innovate, we have to begin to hear the paradox of choice, help them choose wisely, communicate properly to them. Do you want to encourage them because it's the right thing to do, or frighten them in case they're the kind that need a trigger to act? Engage them earlier in the process. Tailor your messages and messaging to who they are, and let them help create better solutions for themselves and for healthcare delivery organizations and for physicians. So the times are right. It may be a perfect storm, but that had a bad ending. I'd like to turn this around and see it as the best opportunity for you to see things differently. So I start where we began, I end where we begin. We don't see things as they are, we see things as we are, and nothing is anymore. And so today was all about not in seeking new landscapes, but in having new eyes, because without those, you're going to have a hard time seeing, feeling, thinking, and then doing. So perhaps as Linda was speaking, she and her information can be helpful to you as you begin this journey. Hope today has been of interest to you. So as we come out to the end here, before I talk about our next one, we did have two questions. Linda, I'm going to let you speak to the first one in terms of how do we engage doctors and staff in the whole process. Would you mind, please?
No, thank you very much. I think that the chance to engage them is to say first say what segments or what particular customer profiles are ones that we serve the most, and then say which ones do we want to serve. And if they're I think that they all have insight and they all want to share their profile of the consumer. So I think that would be a terrific start. Secondly, I'd actually suggest how do you see our customers potentially responding to social media, because everybody has an opinion and then they have a personal position. And then I guess I would say, what if we were to ask them some questions to say, what if we were to profile the patients that come to us the most frequently and see if those are our prioritized types of personas? And by using some of the data and getting their common viewpoints together, you can build a common vision of who do we have and a common vision of who should we go get. And that will help start the alignment discussion. Andy,
That's
do you have other
terrific.
thoughts on that topic?
No, but I do want to talk about this next one because it's near and dear to me. The question that came through is, okay, how are we going to get the men involved other than looking at the copay or the deductibles? And I thought that was a very good one, so thank you for sending that in advance. I was involved at Hurley Medical Center setting up a men's health initiative. There's one in Integrity Health in Oklahoma. The Cleveland Clinic is an amazing men's health program. There's a Dr. Lamb in New York at NYU who's setting it up. I think we're going to have to change. One of the doctors said to me so well that when a man comes in his office, he's an imposter. He sits on the table and he says, I feel fine. And the wife says, oh, no, you don't. When I ask him a question about this or that, he said, oh, it's fine. And the wife says, oh, no, it's not. So somehow we have to change the whole examination room. The room that was set up for a woman is no longer appropriate for a man. And I think there's so much that we're going to have to do to help men want to come and be healthy and not simply be stoics and manly and think that being healthy is not something that's important to them. So I think that we are just about wrapped up. Linda, any final thoughts for the group that's out there, please?
No. Well, the only thing I would say is if you would like to have a profile of your local market for the emergency department for spurring on your own discussions with your teams about the use of the emergency department, primary care, and what kind of marketing tactics might be useful, then please feel free to be in touch with me or Andy, and we will get that set up for you.
And I can't tell you how important that is. That is something that's free and available, and you could take a real good look at your ED and begin to see how to transform it. Just a little pitch. On February 14th, I've decided to do one on healthcare innovation, mastering the front and back end of innovation. What I'm finding is that ideas are abundant, but what do we do with them? And the fear of failure, risk aversion is quite evident everywhere. So I'd like to talk about how to overcome that as we move into looking at the data and seeing what's happening and beginning to try things in new ways. Last, both of us are open to lots of conversation, and we'd be delighted to continue this discussion. I can't tell you how much I appreciate Linda joining me today. She's really quite a professional in what she does, and it's really been a pleasure to work with her. So thank you all, and thank you all for joining us. I'm going to sign off and say goodbye, and thank you, and have a great weekend. Bye-bye now.